Let me ask you a quick question. Did you know that starting February 2026, Medicare is quietly changing the way you pay for your prescriptions? If you're not paying attention, it could cost you hundreds more or save you thousands. Now, don't worry, I'm not here to scare you, but I am here to make sure you don't miss something important. These Medicare changes are big, real, and they affect your wallet. Here's the surprising part. Some costs are going up, yes, but at the same time, Medicare is finally putting a limit on how much you can spend on medications in a year. That's something we've never had before. So let's go step by step and make sure you understand these updates and how to protect your money in 2026. Before we go into the details, it's important to understand why costs are rising. The main reason is that more people are using healthcare services and the cost of prescription drugs has been increasing every year. Medicare is adjusting premiums and deductibles to keep up with these rising costs. That means if you are enrolled in Part B, doctor visits and outpatient care, or Part D, prescription drugs, you should expect some increases. But here's the good news. While some costs are rising, there are also new protections and savings designed to help you pay less in the long run. Let's start with Medicare Part B. Part B generally covers doctor visits, outpatient care, and some preventative services. For 2026, the standard Part B premium is increasing by about $21 to $26.50 per month, depending on your income. That might sound like a lot, but knowing this ahead of time can help you plan. The annual Part B deductible is also going up by $31, which brings it to $288. This means that before Medicare starts covering your doctor visits, you'll need to pay $288 out of pocket for the year. For example, if Mary from Texas goes to her doctor for routine checkups, she'll pay slightly more upfront than last year, but once she reaches the deductible, Medicare starts paying for covered services. Planning ahead is key. Now, let's look at Medicare Part D, which covers prescription medications. The average base premium for Part D plans is increasing slightly by about $2, bringing it to around $39 per month. However, individual plan premiums can vary a lot. That's why it's very important to check your specific plan during open enrollment. The standard Part D deductible is also increasing by $25, bringing it to $615. If your plan has a deductible, you'll pay the full cost of your prescriptions until you reach that amount. After that, your coverage kicks in. Imagine John in Florida who takes 3 medications each month. His out-of-pocket costs will increase slightly, but knowing the new deductible ahead of time helps him budget and avoid surprises. Here's some very important news that can bring real relief. The annual out-of-pocket cap for Part D prescription drugs is going up slightly, from $2,000 to $2,100. What does this mean? Once you personally spend $2,100 on covered medications, you don't pay anything more for the rest of the year. That means no copays, no co-insurance, and no surprise costs. For example, if Susan in New York is on multiple medications, once her spending reaches the cap, Medicare will cover all remaining costs for the year. This is huge because in previous years, there was no limit on how much seniors could pay. Now you have a safety net to protect your savings. Starting February 2026, the first 10 Medicare negotiated drug prices will take effect. Thanks to a law passed in 2022, Medicare can now negotiate directly with drug companies to lower prices on some of the most expensive and commonly used medications. This is expected to save seniors thousands of dollars every year. The good news doesn't stop there. Medicare is already negotiating prices for 15 additional drugs, and new negotiated prices will be added each year moving forward. Let's talk about insulin. Since 2023, insulin costs have been capped at $35 per month. In 2026, you'll continue to pay either 25% of the negotiated price or $35, whichever is lower. That's a big deal for anyone relying on insulin every month. These changes are designed to make prescription drugs more affordable, especially for seniors on multiple medications. Over time, these negotiated prices are expected to save both Medicare and enrollees billions of dollars annually. Here are some simple tips to make the most of these updates. Review your plan carefully during open enrollment. Check premiums, deductibles, and covered drugs. Know your out-of-pocket cap and plan your prescriptions accordingly. Take advantage of negotiated drug prices. Ask your pharmacist or plan about the lower cost options. Track your medications to see when you reach the annual cap. This can prevent overspending. Ask questions if you're unsure. Medicare counselors and local senior centers can help you understand the changes. Following these tips can help you avoid surprises and save money while making sure you get all your needed medications. Here are some questions seniors often ask. Question 1. Will my monthly premium go up? Yes, slightly for Part B and Part D, but the amount depends on your plan. Question 2. Do all medications qualify for negotiated prices? No, only certain high-cost popular drugs. Medicare adds more drugs each year. Question 3. How does the out-of-pocket cap work? Once you spend $2,100, you pay nothing more for covered Part D medications. Question 4. Can I switch plans if I'm unhappy? Yes, during open enrollment, you can review and change your plan to better match your needs. Question 5. Does this affect insulin? Yes, insulin is capped at $35 or 25% of the negotiated price, whichever is lower. These answers help seniors plan ahead and avoid surprises with Medicare costs. Whether you're already enrolled in Medicare or helping a loved one, now is the right time to prepare for 2026. Check your plan carefully, know your out-of-pocket cap, and see if your medications qualify for negotiated prices. These updates could save you thousands this year. We've included a detailed article in the description for anyone who wants more information. You can also watch another Medicare Explainer video by clicking on the screen. And if you have questions about these updates, leave them in the comments. We'll read every question and may answer them in a future video. Thanks for watching, and remember, being informed now can protect your wallet and your health in 2026.